Here we go, a brand new edition of Sports Medicine Weekly on this Saturday morning. Good morning, everybody. I'm Steve Kashul, your Chicago Bulls radio host, joined this week by Dr. Nick Verma. He is the head team physician for the Chicago White Sox and a sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush, subbing this week for Dr. Brian Cole. Dr. Nick, thanks so much for joining us again.
Good morning, Steve. It's always great to be here.
I appreciate it. Well, let's get right into it, and I've got a lot to do on this show, but let's talk about football. Training camps are, NFL, we only have another week or so, it seems, in the regular season. College has been going for the last couple of weeks. High school's underway now, and then, of course, we have to discuss the debate about head trauma, and we're leading to concussions, right?
Yeah, it's scary stuff, Steve. And this really, I think this is probably going to be one of the biggest issues that football in all levels has to face over the next 10 to 15 years. You're a parent. I'm a parent. We talk to other parents. I think that this is the debate that you're actually hearing other individuals have regarding should we even be letting our kids play this sport, and what's the risk long term when we think about the head injuries that are occurring.
Most concussions occur without losing consciousness. So that's hard to figure out, isn't it?
Yeah, I think this has been one of the difficulties with concussions, and one of the areas where we probably made the most progress is we went from an era where, guys would stumble off the sidelines, they'd quote unquote get their bell rung, and they'd be back out there the next series or the next drive. We've now gotten to a point where we're very vigilant about the identification and the screening for concussions, which means that certainly at the professional and the college level and now bleeding down into the high school level, there are independent observers or physicians on the sidelines who are screening players for any signs of an impact that could cause a concussion or any symptoms that may be reflective of a concussion. And in fact, at the major league level and the college level, we've taken much of the decision-making out of the hands of the coaches, out of the hands of the team physicians, and we now have independent concussion specialists who are on site at the games making decisions in the best interest of the player about who can go back and who needs to sit this one out.
We've got CTE we're always worried about, right? We've seen examples of that here in Chicago. Mike Adamle comes to mind, and Mike's been very open about it, the former Northwestern running back and Bears player and Channel 5 anchor. And boys, and some people committing suicide because of CTE.
Yeah, it's really scary to see some of the ramifications that have existed in these players long term with dementia and depression and, as you said, suicides, those types of things that happen. And I think the scariest part is we really still don't understand what is the determining factor. What is the criteria for somebody at risk for developing CTE? Is it the number of concussions? Is it the significance of the concussions? Is it even subclinical blows to the head, meaning can you really never exhibit signs of a concussion but take enough hits or impacts as a running back or a wide receiver and still suffer some of the consequences of CTE? And this is why people are debating whether football is something that we should be allowing our youth to play. I think the main point for those listening in this morning is really the vigilance that goes into understanding that concussion doesn't have to mean they got hit and they passed out on the field. It can be very subtle findings of things like headaches, difficulty standing, blurred vision, really just recovery from sports or performance. We really need to be vigilant about identifying anybody who's involved in a collision that puts them at risk for a concussion, and certainly any subtle signs that a concussion may have occurred. And it really, as parents, as caregivers, or as medical professionals, the onus is on us to take a player out of a game who has a suspected concussion until you can definitively prove that they did not have one.
Yeah, among the 202 deceased brain donors for CTE, it was neuropathologically diagnosed in 177 of the 202. And the mean years of football participation, 15 years. How about that? So
as I said,
it's scary. It really is. Boy, oh boy. My 12-year-old's playing, and he loves it. He plays a little flag football with his junior high team, and then he plays full pads football, and they're trying to keep it as safe. And I said, give me the Gary Fensick way. Hit with your shoulder pads. Keep your head out of it.
Certainly there's training about ways to tackle and how we try to remain as healthy as possible. As you know, particularly as we get to the NFL level, the speed of the game and the speed of the individuals and the athletes is just so fast that even with tackling modification, it's impossible to avoid some of these collisions that occurred. I think what's really scary, though, is when you look at the CTE data is, again, how much even subclinical impacts are predictive of CTE or causative of CTE. So even though your kid may play the entire 4 years of high school without a concussion, could they still potentially be at risk for CTE just because they've endured some blows to the head? And I think we're going to continue to learn about this subject and understand what's safe and what's not safe as we move forward.